This is cisplatin. Cisplatin is an anticancer drug. It works by binding to guanine or adenine bases in DNA, disrupting the structure of DNA and therefore preventing further replication of a cancer cell. Unfortunately, cisplatin also attacks healthy cells, especially fast-replicating cells like hair follicles, which is why hair loss is a common side effect of chemotherapy. This is where polymer-based nanoparticles can help. What are nanoparticles? Nanoparticles are particles that range from 1 to 1,000 nanometers in size. There are many different types of nanoparticles, such as inorganic metal nanoparticles or polymer-based nanoparticles, which I'll be covering in this video. But first, what is a polymer? A polymer is a large molecule made up of repeating units known as monomers. A copolymer is a polymer consisting of 2 or more monomers. There are 4 different types of copolymers, including random copolymers and block copolymers. Random copolymers have their monomers randomly arranged during polymerization. Block copolymers, however, consist of blocks which have a linear arrangement. In a diblock copolymer, as shown here, you have an A-B arrangement, with the green circles making up the A block, and the blue circles making up the B block. In a triblock, you can have an A-B-A arrangement, or an A-B-C arrangement with a third unique block. There are many different kinds of polymer-based nanoparticles, including micelles, dendrimers, liposomes, and, the main focus of this video, polymeric nanoparticles. When an amphiphilic block copolymer is added to an aqueous environment at the critical micelle concentration, they self-assemble into a polymeric micelle. This is because the hydrophobic chain is repelled by water, while the hydrophilic chain is attracted to water. As a result, the following sequence happens. Here is the hydrophilic chain, and this is the hydrophobic chain. As a result, a polymeric micelle with the hydrophilic chains as the shell and the hydrophobic chains pointing inwards is formed. Hydrophobic drugs can be held within this core. Polymeric nanoparticles are solid, insoluble nanoparticles that can be loaded with active compounds entrapped within or surface adsorbed onto their polymeric core. There are 2 types of polymeric nanoparticles, nanocapsules and nanospheres. In a nanosphere, the active drug compound is universally dispersed or covalently bonded to the solid polymeric matrix, while in a nanocapsule, the active compound is stored within a polymeric membrane shell. Within the core of a nanocapsule, there is an oil surfactant, which must be highly soluble with the drug and non-toxic. There are 4 common methods for forming polymeric nanoparticles: emulsification solvent preparation, nanoprecipitation, salting out, and supercritical anti-solvent system. Polymeric nanoparticles were first synthesized via emulsification solvent preparation. In this method, polymer is dissolved in an organic solvent, such as chloroform, to make up the organic phase. The aqueous phase consists of water and a stabilizer or surfactant. The 2 phases are then combined via high-speed homogenization, resulting in a water and oil emulsion. The emulsion is then stirred continuously at room temperature or reduced pressure to evaporate the solvent. The main downside of this technique is the high energy cost of homogenization. This technique is most often used to produce polymeric nanoparticles for the encapsulation of hydrophobic drugs. In salting out, a water and oil emulsion is first formed under mechanical stirring through the addition of the organic phase with the aqueous phase. The polymer and drug are dissolved in a water-soluble solvent, such as acetone, to form the organic phase. The aqueous phase contains gel with stabilizer and a high concentration of salting out agent. Magnesium chloride is a common salting out agent in electrolytes, while sucrose is used in non-electrolyte systems. The emulsion is then diluted in a sufficient volume of water to enrich the diffusion of the organic solvent into aqueous phase, decreasing the ionic strength in the electrolyte. This results in hardened polymers. The pressure is then reduced to remove the solvent, and ultracentrifugation and repeated washing is used to eliminate both salting out agent and stabilizer, leaving behind only the nanoparticles. Unfortunately, all the techniques so far use potentially toxic organic solvents. On the plus side, supercritical fluid technology can remedy this issue to produce high purity nanoparticles without any traces of solvent. A supercritical fluid has properties of both gases and liquids above its critical temperature and pressure. In a supercritical anti-solvent system, the polymer is dissolved in solution and sprayed through a nozzle into a high-pressure vessel containing liquid supercritical carbon dioxide, which acts as the anti-solvent. At a high enough pressure, carbon dioxide rapidly dissolves into the polymer solution, causing the polymer to precipitate. After precipitation, the anti-solvent flows through the vessel to remove any remaining solvent. When enough solvent has been removed, the vessel is depressurized and the solid powder is collected. When the vessel is depressurized, all the liquid carbon dioxide reaches gas phase. Unlike conventional capsules and tablets, nanoparticles are small enough to pass through the smallest capillaries and can overcome biological barriers such as the blood-brain barrier. This means it can be used for neurological diseases. The structure of polymeric nanoparticles can easily be modified, which allows for controlled and sustained drug release. They are used over toxic inorganic nanoparticles because they have lower toxicity and increased cellular uptake. Poly-D-L-lactide coglycolide, also known as PLGA, is the perfect example to demonstrate the variability of polymeric nanoparticles. PLGA is an ester copolymer of lactic acid and glycolic acid. PLGA is approved by both the FDA and the EMA for drug delivery due to its great biodegradability. PLGA degrades hydrolytically in an aqueous environment with the ester linkages along the backbone being randomly hydrolyzed to form one hydroxyl group and one carboxylic acid group. Eventually, the long polymer chain is broken into many water-soluble fragments. Its hydrophobicity decreases with the decrease in molecular weight. These fragments, in turn, are hydrolyzed to form lactic acid and glycolic acid. PLGA is considered non-toxic because these monomers are metabolized during the Krebs cycle and then decomposed to form the non-toxic compounds, carbon dioxide, and water. One useful property of PLGA is its controllable degradation rate. As polyglycolic acid is hydrophilic, it is much more susceptible to degradation by hydrolysis, while polylactic acid is hydrophobic. This means that increasing the ratio of lactic acid to glycolic acid decreases the rate of degradation by increasing the hydrophobicity of PLGA, which results in a slower drug release time. PLGA-based nanoparticles have been successfully used to encapsulate anti-cancer drugs, such as cisplatin and doxorubicin. These nanoparticles can target tumors in two ways, passively and actively. Enhanced permeability and retention effect is where nanoparticles can pass through gaps between the abnormal endothelium cells and accumulate more in tumor tissue than normal tissue due to poor lymphatic drainage. Healthy cells are much less likely to be attacked as they are protected by the tight-knit, healthy endothelium cells. Factors for maximizing EPR effect include nanoparticle size. Larger particles have a greater drug-loading potential, but smaller particles can overcome more biological barriers to reach the specific disease site. Shape. Internalization of needle-shaped nanoparticles by endothelial cells was 150% higher than spherical-shaped nanoparticles. Surface modification. The most preferred coating is of polyethylene glycol. It results in improvement in the blood circulation half-life of nanoparticles. Unfortunately, EPR effect is not feasible in all tumors as changes among tumor types, patients, and just over time occur. Active tumor targeting works by adding ligand modifications to the surface of PLGA-based nanoparticles that can bind to specific receptors or antigens on tumor cells. However, these ligand modifications increase the risk of destruction via phagocytosis. Another issue is that tumor receptor expression changes over time. There are, unfortunately, some downsides to using PLGA to deliver drugs. It's got low efficiency drug loading for lymphophilic drugs. The initial burst release of drugs caused by drug adsorption on the surface of nanoparticles can result in the drug not reaching the target tissue or cell. Acid production upon degradation of PLGA could damage any acid-sensitive drugs. Fortunately, there's always research being done on polymer-based nanoparticles. There's currently being research done on hybrid PLGA nanoparticles. That being said, thank you for listening, and I hope you enjoyed.